Everyone. Welcome to another Tuesday Tips. We are going to be talking about the stages to a successful pre-office visit planning. So thank you for joining us, and let's dive right into the stages of successful pre-visit planning. So as the year draws to a close, this would be an excellent time to review your pre-office visit planning workflows. Are in the current state that it is in, is it still working? Is it still effective for you? Um, is there anything that within that pre-office visit planning that is not working currently? Is there anything that perhaps you want to identify and consider to change and improve and to make sure that it is effective and efficient for you? I often say that it's recommended to, work with your clinical and non-clinical staff that has direct patient contact. And remember, each physician practice has a unique size, scope, staffing resources, roles, and patient volumes. And so there is not a one size fits approach for all. Instead, you want to focus on your practice current infrastructure to determine which pre-office visit planning stages are suitable and applied to your practice. So what does that mean? Planning for an office visit can be helpful in several ways. By performing a pre-office visit planning workflow, clinicians and clinical staff can prepare the patient's chart in advance with ordering diagnostic lab or radiology orders, retrieving results, and if applicable, any medication management necessary. This helps save time, reduce stress, and lower costs while allowing the care team to manage any unexpected issues that may arise during the visit. Overall, a pre-office visit planning can help things run smoothly and ensure a better patient experience. If this is something your practice is struggling with, you can certainly try a pilot. The beauty about a pilot is that you're in the stages of not only trying to apply the improvement or changes that you're making. It isn't anything permanent just yet. You're determining from a pilot whether what is actually in that workflow or your future workflow that works best. And once you've determined that, then you would implement that on a permanent basis, knowing that you might revisit that again and there's might be something that is going to change in the foreseeable future. That said, again, let us do a deep dive into the stages of a successful pre-visit planning. So before the patient checks out, the practitioner is or physician is wrapping up the office visit. They're indicating interval care by ordering lab values, radiology studies, or perhaps a referral to a specialist if they are in family medicine or needing to go see a specialist, and so in their next visit. Then what you're going to do with that is that you want to indicate in the patient's schedule when that next follow-up is going to be before they leave. Again, this is going to be dictated by your practitioner as instructed if there's any follow-up or any other studies that are being ordered because of interval care. Second, you want to place your orders now for future appointments to save that time. And then you want to arrange lab values and diagnostic radiology studies, when applicable, again, dictated by your physician or practitioner, and highlight on the patient's after visit summary the following action items before the next time they arrive. Or if there's a follow-up appointment in the next 3 months, then you want to highlight those action items that the patient needs to get done. So that's your, before the patient checks out. The next column is your chart preparation for the upcoming visit. Similar to the same theme that we talked about last week in pre-visit planning for the front desk, you want to review your upcoming schedule for the week. You want to make sure that you're using this pre-visit checklist to review the patient's chart, review the chief complaint or agenda, the reason why they're coming for the visit from the last time. If it's a follow-up, if it's a 3-month follow-up from the last time, whether it's a chronic condition or something that was discussed with the practitioner and patient that they need to come back in 3 months or come back in 2 weeks or come back in a month. Then you want to review the lab and radiology test that was ordered by the practitioner. You want to retrieve those from the facility where it was done. And depending on your electronic medical record, if there is integration, if the results actually come in electronically through lab results, then you'll be able to retrieve that from your electronic medical record. So what that means is that the facility is sending to you electronically the results of your patients that you sent orders. And so you'll be able to retrieve that. The other is that, if you sent the patient and you to a specialist and there's a referral and there are notes or letters that you're expecting to come back to your office, again, dependent on your electronic medical record, if it's one thing that you can integrate or it's something that comes in electronically and you don't have to call for that in the referring specialist office to retrieve the letter or note, then that's something that you can also review within the patient's chart, or where you're getting your results or letters and notes are coming in, whether to your practitioner's inbox and whatnot. Then you want to, if there's any abnormal results, you want to definitely share that with the ordering practitioner, make them aware of what these abnormal results are so that they can also be communicated to the patient prior to coming to the visit, or if not, that would be something expected to be reviewed at the time of the next coming visit. Then you want to send your patient reminders. Again, this is dependent on your electronic medical record, what functionalities you turned on to send patient reminders, whether it's the patient portal or if it's something that's a text SMS. If you're using that functionality to remind your patients that, hey, we have an upcoming appointment in a month or 2 months or 3 months, looking forward to see you, or your reminder, make sure that you update your information prior to your checking in, and that we look forward to seeing you. The fourth bullet that I'd like to mention is that, again, depending on the practice and depending on your assigned clinical staff, if it's a one-to-one ratio with your practitioner, or if it's a shared or rotational in that kind of way, then it would be something that they can review with the practitioner or physician that they're working with in preparing for this week's patient appointment. For complex patients, or if they have chronic conditions and they're coming back every 3 months, you might want to consider, again, depending on your size and scope and your staffing resources and your roles, a pre-visit call to patients so that you can update the information, particularly if they're on the geriatric side and they might have some challenges. They may or may not have a caregiver that comes with them, and you want to update that information. It might benefit to have that pre-visit call. It could be done with a medical assistant, an LPN, an RN, and again, it's depending on your size and scope of your practice. You want to do that pre-visit call to update the information, but also what are they coming in for? Double checking to see if there's anything else that have changed from the last office visit. Now we're going to segue into the day of the patient visit. So once you've prepared your chart, you've gotten it all squared away for what's on that upcoming list. You've gotten all your results, your notes, your charts are ready and set to go. Then I would say at the day of the visit, it would be a benefit if you have a team huddle with everyone, your clinical staff and your practitioners and your physicians, to be able to talk about what's happening in that day. Do a care team huddle to see what are some of the upcoming situations, or exchange information about that busy schedule. Is there something that is going to be a fire that you need to resolve, or if it's something that you expect something to happen, and so you're going to make that notation so that when the patient arrives, you're already prepared because that has been discussed. And if there's anything that is unexpected, then you'll be able to mitigate that action because you already had that discussion. Then when rooming the patient, if you are giving the patient a questionnaire prior to at the waiting room, anything that is relevant to their visit. And then when the MA room the patient, or if you have an LPN, again, depending on your staffing resources and roles, and then they want to review that questionnaire pertinent to the visit that they're coming in based on that scheduled on their last checkout, because this is their upcoming future visit. Then your clinical staff can quickly update the practitioner about what's happening with the patient and giving them a warm handoff. That warm handoff allows them to focus what is going on with the patient based on the questionnaire that was given. And it also focuses on the portion that the practitioner or your physician will just focus in about the patient. And lastly, you also want to make sure that as you're giving that warm handoff and as you're giving that information to your practitioner or physician, it also sets up to meet the patient expectations and needs. So those are the benefits of a successful staging of a pre-office visit planning. It aims to prepare the clinic for chart efficiency. This saves the practitioners and the staff time, because the preparation allows the care team to work more smoothly with their practitioners and physicians, and reducing frustration and wasted time. I hope this was beneficial for you in your practice. Again, as I said, each practice is different. Each physician practice, it has a unique set of size, scope, staffing resources and roles, and patient volumes. And so it's not a one size fits all approach. Instead, focus on your practice's current infrastructure, determine which pre-visit planning is going to be applicable to your practice. And if it's something that again, as I said, you're struggling with, you want to perform a pilot, because a pilot, what it does is it reveals to you what are some of those stages that will work for your practice and what isn't. And so things that are going to work for you efficiently, that's going to be effectively because you improved a certain area of that. Stages, whether it's before the patient checks out, or the chart preparation for the upcoming visit, or the day of the patient visit, those elements you want to consider which ones of those pieces are going to function beautifully as a whole with your practice. And you're giving the patient a better experience, and also noting that the care that you've given, because you are prepared and you're also running the office efficiently. Thank you for joining me on another Tuesday Tips. I hope to see you again. Have a great Thanksgiving weekend, and take care.